In Hutchinson-Gilford progeria syndrome, the rate of aging is accelerated up to 7 times that of normal aging. The children are born looking completely normal, and it is not known that they have this syndrome until they are 6 months to a year old. This is found from profound growth failure or failure to thrive. This syndrome is extremely rare. Incidences of this syndrome is estimated to be 1 per 8 million births. The male to female ratio is about 1.5 to 1. Most of the cases recorded have been Caucasians. They have a mutation called GLY608-GLY. It causes 150 nucleotides encoded in exon 11 to be spliced out of the final mRNA and results in a protein that lacks 50 amino acids. The mutation is on the lamin A, also known as LMNA gene. It substitutes GGT for GGC. There are other known mutations, but this is the most common. About 90% of all cases. Some symptoms of this disease include a bird-like face, high-pitched voice, alopecia, prominent veins on the scalp, big eyes, micrognathia, abnormal and slow dentition, pear-shaped chest, short clavicles, bow legs, short upper limbs and prominent articulations, low stature, incomplete sexual maturation, reduction of adipose tissue, osteolysis, osteoporosis, horse riding stance, thinning cranial bones, delayed closure of cranial sutures and anterior fontanelle, easy bruising, thin lips, absent eyebrows and eyelashes, anodontia and hypodontia, dislocation of the hips, and thin limbs. Children with this syndrome are recommended to take low-dose aspirin to help with their high risk for heart attacks and strokes. This is really the only thing that has been proven to help. There are a few pending treatments being tested. Farnesyl-transferase inhibitors being one of them. The tests on this type of drug have shown to increase the lifespan by 80%, improve growth of hair, and less bone breakage. They think this type of drug helps so much because it reverses vascular disease and mimics progressive arteriosclerosis. The downside of this is that it has only been tested on mice with progeria, so we do not know how exactly it works on humans. Children die of heart attacks or strokes generally between ages 6 and 20. The average lifespan is about 13 years old. 75% die from cardiovascular diseases. The only way you could know if your child has this syndrome before it is born is through amniocentesis or chorionic villus sampling. With this, they analyze the DNA of the fetus. The only reason they would even consider doing this is if there is the disease-causing allele identified on a family member. There isn't a lot you can do right now to help a child with progeria. Hopefully we can do more research for them in the near future. Now let's hear what Haley Olkwines has to say about progeria.